Okay, welcome everyone. Thank you for joining us for our Elevating Dignity session, Making Space in the Face of Adversity in Solidarity with Our Asian Community. We want to thank you all for joining for this event today, and we can make space for this dignity for our Asian American colleagues and their families. Before we start, I wanted to share a couple ways that we can participate in the event today. We want to ask everyone to stay on mute unless called on or invited to share. That being said, this is going to be a discussion, and we do invite you to come off mute or share on the chat box as well. So we will have moments throughout the presentation where we invite you to have your voice in the room, so please feel free to do that at those times. If you can enable your cameras, we would love to see you and be as in person as possible. We understand not everyone has the technology to do that, but if you can, please turn on your camera. And please find out where the chat box is on your screen right now, because we will be using that as well. If you're more comfortable sharing your thoughts or experiences or anything you'd like to share in the chat box, you can select everyone and type a message and click send, so we can all be part of the conversation and see what you're sharing into the room. Lastly, I just want to note that all the session today will be recorded. So we are recording right now, and we will be recording the entire session for those who weren't able to make it today. And with that, I'd like to start by just creating space for dignity and asking for a commitment from everyone on the call today. We will be talking about some topics that are hard to speak about, hard to hear, hard to process. So we want to make sure that through those challenges, we're creating a safe space for those who want to bring their voice into the room. So as I read the commitment today, I just ask that you keep these in mind when you share today and you have these conversations. I will listen and be present. I will be open and inclusive. I will be willing to learn. I will come with curiosity, not judgment, and assume good intent. I will speak from the self and use I statements. I will allow others to speak without fear of retribution. And if I had violated someone's dignity, I will apologize. These are all elements of our dignity model that we have adopted here at Baystate Health from Dr. Donna Hicks, and we will be going into that further into this presentation, but please keep these in mind as we are speaking to one another today. So we want to start today with a short video, so I'm going to play that for you now.
I've heard people make comments like, thanks for bringing the virus over.
Didn't it come from you guys?
A passenger told me that I should go back to China.
I've had strangers cough at me.
People move away from me.
Someone spit 3 times towards my direction. I felt so violated. My biggest fear is that all the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
Everyone has to keep everyone else safe. We all have to play our part.
I've been spending 8 to 10 hours a day making masks.
I donate my plasma.
As an essential worker, I'm delivering food, groceries for my community.
I mean, I know I'm putting myself at a little extra risk. I'm happy to do it.
It's really hard to talk about racism when all I want to do is cry about it.
You have to talk about it to other people. You have to tell them these things exist.
We're all human.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse, not a virus.
I'm a delivery woman.
I'm a rideshare driver.
I'm a chef, a neighbor,
Artist,
Bus driver.
I'm a doctor.
Fight the virus, fight the virus.
Welcome everyone, and thank you for joining our 3rd Elevating Dignity program, where we stand in solidarity to stop anti-Asian racism. As you saw in the video, it says stop affecting and stop using words, fight the virus, but also fight racism. This day of coming together as one Baystate is a testament to who we are, who will we become, and what we inspire to be. However, I wish that today was different. It has been a long, hard year of multiple pandemics, COVID-19, racism, discrimination, economic, education, etc. As you saw the young woman talk about, it's hard to not have tears in your eyes when you think or talk about racism. I once read a haiku that said, "It is through friction that two pieces shape to work smoothly together." We are together because there has been much friction. But when we work together, hearing and lifting each other's voices, concerns, and making and adopting systemic change, things will get much smoother. But as we start today, we need to recognize and reclaim the dignity and remember the lives that were lost. The Atlanta shooting, Soon Chung Park, 74, Han Jung Grant, 51, Sooncha Kim, 69, Young IU, 63, Delana Ashley Young, 33, Paul Andre Michel, 54, Zhaoji Tan, 49, Dao Feng, 44, and San Francisco murder, Vicha Ratanapakati, 84. Let's remember these faces. If we can take 30 seconds to remember the lives lost. As we remember and reclaim their dignity, let's also recognize that we need to end the violence against Asian Americans. Zhao Zhenzi, age 75, and Ngang Pham, age 77, they were both attacked in San Francisco by the same assailants. And what she did, they started a GoFundMe page, and she raised $1 million and donated all of that funding to the AAPI community in hopes to combat racism so that the younger generation of Asian Americans can all stand up for one another. Let's also recognize the other acts of violence. Bao Kung and his sons, ages 6 and 3, all three were violently assaulted and wounded in Sam Club in Texas. Kelly Yang and her children, ages 10 and 7, verbally assaulted in a park in California. Douglas Kim, a Korean restaurant in New York City, vandalized. Let's take this, and there's so many others that we cannot even list on this page. So let's take time and a moment to reclaim their dignity, and let's recognize all these individuals and what they have gone through, and let's all commit to end the violence against our Asian Americans. And as we recognize and reflect and reclaim the dignity, I'd like to invite Reverend Uta Smith, who will lead us in a moment of silence and reflection.
Friends, let us be together in a moment of silence, reflecting on the losses and reflecting on the gifts of our Asian American friends here at Baystate and beyond. I'm going to use the bell for a moment, and then I'll lead us in some words of prayer. Source of our hopes, healer of every ill, breathe in and among all of us who dwell in this land. Soothe our wounds, calm our fears, mend our divisions. Hope of all our tomorrows, open our ears and hearts, and fill us with compassion and the ability to honor the dignity of each person. Fill us with courage to speak up and stand in solidarity. Tender our hearts and send forth your spirit of love, solidarity, and a deep sense of togetherness and resolve. So be it. In the name of everything that's holy and sacred and alive. Amen.
Thank you so much, Reverend Uta Smith. And so as we have a moment of silence and a moment of reflection, I just want to remind us of what makes us Baystate. You know, here is our Baystate platform, and one of our core values is respect, honoring the dignity of all people, not some people, not this group. It's all people the people that work at Baystate, all the people we interact with, all the patients in the community that we care for every day. We have the opportunity to be the light in this region, but not only in this region, in this nation. And our core competency is valuing differences. These differences that we bring, whether it's our talents, whether it's our gifts, whether it's our skills, whether it's our culture, our religion, our thoughts and experiences, aid in this mission. Aid in the mission to improve the health of the people in our communities every day with quality and compassion. We should never forget those tenets that guides our work. And so we are one Baystate, every single one of us. No matter what package you came into this world, we are one Baystate. And as we are one Baystate, one of the letters that Dr. Carrick, our president and CEO, and our Chief Human Resource Officer, Kristen Morales-Milieu, talked about working together to elevate dignity. And so I want to read their words. They said, at Baystate Health, we acknowledge the basic dignity of every individual and treat everyone with respect. This is at the core of our values as an organization. In bold, neither our employees, nor their families, nor their extended communities deserve to live in fear. While acts of aggression and violence can make us feel angry or powerless, we are convinced that, in bold, we can take action to make a difference both individually and collectively. We hope you will join us in continuing to accelerate Baystate's efforts to advance our work on diversity, equity, and inclusion. When we engage in activities that enhance well-being and equitable treatment of all people, we help ensure a safe and nurturing environment at Baystate Health, where people from diverse backgrounds do their best to, in bold, work together, taking care of patients and each other. Taking care of patients and each other. And today, we are taking care of our fellow Asian American and Pacific Islander community today. Because what affects you affects all of us. You are an extension of who we are. You're an extension of our work. And today we honor you and we stand in solidarity with you. Why? Because as Kara mentioned, at Baystate, we have adopted the dignity model. And when we think of the dignity model and we think about that, it's important as we talk about the dignity model, we need to reflect on the history of AAPI racism. What happened this past year, although there's been a 150% increase in acts of violence and racism towards our Asian American and Pacific Islander community, it is not new. So it's important, in order to eradicate or eliminate racism, we must know our history. So first, 1871, Chinese massacre, when a mob in Los Angeles and Chinatown attacked and murdered 19 Chinese residents, including a 15-year-old boy. In 1882, Chinese Exclusion Act. The act banned the immigration of Chinese laborers. Following 1870, and also in 1875, we had the Page Exclusion Act. The nation's first restrictive immigration law had prohibited the entry of Chinese women. In 1939 to 1945, World War II, we saw forced internment of 120,000 Japanese Americans, where 62% were U.S. citizens. After the Vietnam War, refugees from Southeast Asia faced routine discrimination and hate, including attacks by the Ku Klux Klan members on shrimpers in Texas. And in 1982, Vincent Chin, a Chinese American, was beaten to death by two Detroit auto workers who they thought he was Japanese because they killed him killed him because they thought they blamed him on the rise of Japanese auto industry. So when we look at this history, this did not begin in 2020. This has been a long historical impact of our Asian American and Pacific Islander community. It is important that you educate yourself, that you understand, and of course, I didn't add 2020, when the virus was attached to a group of people of an identity where you have this picture, I am not a virus. We have an opportunity to not only educate ourselves, but to shift the narrative and how we think and view and lift each other up. How do we do that? We do that through the dignity model. We do that because all human beings have a profound desire to be treated with dignity. It is part of our evolutionary inheritance, the need to be seen in a favorable light. And so today, we're going to use this model and framework, and we're going to use this where you're going to hear stories that talks about acceptance of identity, that talks about inclusion, that talks about acknowledgement, and then talks about safety. Hear from your colleagues today about their journey and what this has meant from them. And so I'm so happy to introduce our first speaker, who will be talking about acceptance of identity. And so I want to share the definition. When you want to honor people's dignity, you need to accept that they are neither inferior or superior to you. By virtue of being human beings, we all have the same inherent worth and value, the same human vulnerability. Start with the interaction, that no matter who they are, what their race, religion, gender, class, sexual orientation, it is your obligation to humanity to accept them as your spiritual equal and do them no harm. Please, I'm happy to welcome Joel Vengco, SVP Informatics and Technology Chief Information Officer, as he talks about his journey on acceptance of identity.
Thank you, Yemisi, and thank you so much for putting this together. I want to thank also Kara Wolf for helping to put this event together, and of course my colleagues here, my Baystate Health community. I feel so fortunate and grateful and very blessed to have your support and to have you participate in this event today, especially through these challenging times. But I absolutely feel so much gratitude for the way that this organization has dealt with many of these challenges. And I just feel so lucky to be a part of this community with you. I have the honor to sort of share my story. And so hopefully you'll bear with me throughout the story about how I came to the United States. I was born in the Philippines. I won't tell you what year. You'll figure that out just by some of the math that I'm going to give you in a minute. But I was born in a small town outside of Manila, actually named after my two grandfathers, my lolos, which is grandfather in Tagalog, which is my native tongue, Jose and El Pijo. So actually my name in my family is actually Joel, although in America it's Joel, and that's absolutely fine. But you'll hear my mother and father call me Joel when they speak to me or when they're upset with me. But I have very fond memories of my childhood in the Philippines. These are pictures of when I was there with my Lola, which is the grandmother in Tagalog, and my pinsans, my cousins. And I just recall so much wonderful things that happened, so many wonderful things that happened to me during that period of time. Everything from, the food that we ate, like lechon, which is, a roasted pig, to festivals like, you'll see a picture there in the corner, that's a Catholic procession festival of our patron saint in our town. And that was a festival that was occurring, and you'll see me actually. My mother is in the red dress there, and that's me putting my hands in my ears because they were doing fireworks, and I was probably afraid of the fireworks. But I really remember the comfort and the happiness and the belonging that I felt when I was growing up in the Philippines. Next picture, please, Kara. In 1978, my father made the difficult decision to leave the Philippines due to martial law that was being enacted by then President Marcos, who was an emerging dictator. My father was really afraid of this regime and what it meant for his family and his sons. And so he felt that the risk of staying was a lot higher than the risk of going. And so he embarked in his journey to the States. And while he did leave, he also vowed to help his family and his community back home if he were to succeed. Ironically, the last administration brought back some of those memories that both my parents felt when they were making the decision to leave because of what they had remembered hearing and feeling during that time in the Philippines. But this picture here of my father on the tarmac in the Philippines is a very prominent picture that is hanging in our study today in my home, just to remind me and my kids of our beginnings and who enabled us to be where we are today. Next picture, thank you. And a year later, my mother and I then left to meet my father and in the States, but leaving my little brother behind because we couldn't afford to bring him. And when we got to the U.S., I didn't know how to speak, of course, a word of English. And in my family, my mom and dad literally only had $500 to our name when I got to the States, which is around $2,000 equivalent today. But my dad, however, did have he made a lot of friends and family friends who actually lived in San Francisco, he had discovered, and they put him up while he was looking for a job. And preparing to accept my mother, my brother, and I to the States. And when we got there, he had an apartment that was and I tell my kids it was no bigger than their bedroom, actually, a very small apartment. But it was really the Filipino community that supported my dad and embraced me and my mom as we arrived in the States. And they actually took care of me while my parents worked 2 to 3 jobs during those years to come. Simply to support our family. Next picture. So my 4th birthday happened a year later, and a lot of quote unquote cousins and titos and titas, which is uncle and aunt, had adopted us. And in the American Filipino community, we don't call folks Mr. or Mrs. In fact, we call them tito or tita or lolo or lola, which is grandmother and grandfather, uncle and aunt, this is tita and tito. Simply, I think because, we left a lot of family behind, and we wanted to create that connection with folks who we felt connected to somehow. And so that's how we address them. And in that regard, we rarely felt alone because of our community that surrounded us and supported us and took care of me, quite frankly, when my parents had to be working. So both my parents were university educated in the Philippines, but because of their foreign degrees, their very heavy accents, they were not afforded the opportunities at the time to acquire jobs that were really, commensurate with their skills and their degrees. And as I spoke to my mom recently about her challenges, because she helped me get these pictures, she lives in California with my father. Ever the optimist my mom is, and she said that she saw the best in people when I'd asked her if she had these challenges with prejudice, and how did she feel when she encountered folks who wouldn't give her a chance. But she told me that she never really had a bad experience, just an opportunity to learn and to teach when she could. She told me the story about one of her coworkers when she landed her first job as a teller at a bank in 1980. And my mom was talking to her coworker, about her hopes and her dreams for her family, and also the family that she left behind in the Philippines that she longed to have with us. Her coworker went on to say, something about immigrants who can't speak the language shouldn't be taking, their jobs. They don't pay taxes, and so they shouldn't be here, and they expect handouts. And at some level, it sounds familiar, and even today. So that's sad, of course. But my mom just kept working hard and showing Cheryl that she was capable, deserving, and no different from her. And soon Cheryl actually became one of my mom's biggest advocates and allies. She taught her more English, and my mom showed her a new culture. They became great friends, and in fact, they still stay in touch today. The following year, I went to kindergarten, and I remember it being very difficult, a very difficult time for my mom, and mostly because I didn't speak English. And my first report card was not very favorable. And those of you that are Asian know that that's not, that is a big deal. But one of my teachers was not at all sparing on describing how confused I seemed to be and uncommunicative I was. She added in the report card already full of check minuses that my mom should no longer talk to me or speak to me in our native tongue, which is Tagalog, and that I need to learn the language. Of course, my mom thought that was ridiculous and explained to the teacher that she would do her best. But her thought process was being bilingual was just fine, and that she would keep speaking to me in our native tongue. So a year later, we did move to Sacramento because of my mom's new job. And this picture here that you see in front of you, I dare you to find me. You probably can't find me in that soccer picture. Of course, that's a joke. But after a couple of years of public school, my parents saved enough money to send me and my brother to Catholic school. And we were able to do a number of activities like you see there with the soccer photo. And I just remember, this was really sort of the first time that I felt that I was different from everybody else because, not just of my skin color, but also because we did a lot of things that were different. Food was different. I remember going to lunch, and I would be the only one that would open up, a sort of a plastic bowl covered with tinfoil, and it would be of rice and of some kind of chicken, like a chicken adobo, and everybody else would have sandwiches. And I was sort of embarrassed, and I just sort of wished that my parents would just make me a peanut butter sandwich, even though I just couldn't stand peanut butter. But in retrospect, I know my lunch was certainly better than theirs at this point. But over time, what actually was really remarkable was that those same kids who would look at me funny were starting to share my food, and they got a taste of something different. And that was really sort of a neat occurrence. And it's coincidental too that my kids had the same experience. Not that they were being looked at differently, but they started to share their Filipino food with their friends at school, and their mothers and fathers asked for the recipes, which was really kind of a neat turnaround and sort of a fun thing for me, especially. But that picture of me there with that sign is actually First Communion. And what you'll maybe not notice, but I'm going to point it out, is that if you look at my hand, it's sort of very tan hand, right? But my face is sort of a little paler, and that was because my parents would put talcum powder on my face to make me fairer skinned. And that was, sort of the thing that many, I think, minorities would do, even in their own countries, because fairer skin oftentimes meant higher class. And so it's just a really interesting sign of those times, I think, even in the 80s. Next slide, please. Sometimes our communities, though, that my communities would overlap. My school community, who was mostly Caucasian, and then my Filipino community. And I get a chuckle out of this picture specifically because one of my great friends back then, John Lawson, is in that picture, and clearly is smelling the food on the table and not enjoying the smell, but certainly just kind of a fun, pictorial of those who end up actually being brave enough to join me and the gaggle of Pinoys that are around me to celebrate something like my birthday in this case. And as I think you all would agree, your parents focus on protecting you and focus on trying to keep you safe, and that was no different for my parents. They've always focused on making sure that we were protected, and always did fear that potentially we would get into a situation that would hurt us, or we would face prejudice, and that we would not be able to perhaps address it in the way that they would hope. But eventually, they did feel that they gave us the right tools. And they felt confident in the fact that we knew who we were, and that they felt solace in the fact that we knew how to engage, educate, and stand up for ourselves and for those who are like us. Next picture, please. So I did end up, coming to the East Coast eventually for school. I married my college sweetheart, and she's of Irish and Italian heritage. And we have 3 beautiful girls, and I have the similar hopes and dreams and concerns that my parents had for me and my brother. And these 3 girls are multicultural, but I'm also proud to say that they identify themselves very strongly with our culture, with the Filipino and Asian culture. 3 years ago, though, one of my fears did come to reality, and we were in Vermont and at a sandwich shop, and we were grabbing some food, and we were in line, and there was a man sitting at a table in the corner behind us, and out of the blue, I heard him say, "You should go back to your country." And so I ignored him, hoping that he wasn't talking to me or to my kids. And then he said it again, and this time he said, "Obama gave you our jobs. Go back to your country, chink." And I knew he was talking to me at that time. And I said to my wife and kids that we should go. I tried not to make eye contact with the individual or be confrontational. And as we were walking out, my oldest daughter, who was 14 at the time, looked at the man, and he said, "You don't have a right to talk to my dad that way. He works very hard every day for us, and he's an American just like you." And then we got in the car, and I realized that everybody was shaken up. My wife was shaken up. My kids were in disbelief because they'd never seen that before, and that was unimaginable to them. They'd never experienced that before. But it was a lesson. It was a life lesson for them. We've talked about it since, and with these recent incidents, we've talked about it again. But my wife and I talked to them about it in a way where we helped them understand that it's not about hating back. It's not about, and it's certainly not about being afraid. It's about knowing who you are, and it's about you teaching. It's about you understanding, and it's about you stepping up. So my life has been blessed with a lot of challenges and celebrations, and all along the way, the communities around me, the Filipino community, but also the allies that have been my community, have been around me to help me and my family prosper, though, as we have. And I'm blessed to say that that's been an ongoing lesson, but a lesson and a support system that I absolutely relish and I'm grateful for. I'll leave you with one last story, and I'm sorry I'm going on here, but in the spring of 2019, I was in San Francisco giving a talk at a conference. And as I usually do when I'm close to my parents, I'll call them up and say, "Hey, maybe it's driving distance for you. Do you want to come and see me?" And so I called my parents, and they came down to San Francisco to stay with me. And we were walking to dinner, going down Geary Street near Union Square in downtown San Francisco. And I was holding my mom's hand, and she squeezed my hand, because she wanted to say something. And she said to me, "I remember in 1979 when your pa and I and you were walking down this very street. And we weren't sure if we were going to have enough money to pay for rent. We weren't sure if we were going to have enough money for food, or we weren't sure if we were going to have to go back to the Philippines. But look at us now, anak," which means child. "Look how far we've gone. We're so proud." And as my mom and I collected these photos and reminisced, and I thank you for letting me share my story with you, it's been very clear to me the kind of support of the community and the blessings that I've had. And it hasn't stopped here at Baystate. It's only continued. And so I'm so grateful for all of your support. And I'm going to leave you with one last quote here from a Filipino author, Carlos Bulasan, who wrote America is in the Heart. And I'm going to read to you a quote, a little redacted, but I'll give you the quote. We are all that nameless foreigner, that homeless refugee, that hungry boy, that illiterate immigrant, and that lynch body. All of us, from the first Adams to the last Filipino, native born or alien, educated or illiterate, we are America. Thank you so much, everybody. And thank you, Yemisi.
Thank you so much, Joel. I'm kind of choked up a little bit. So it's, whew. I appreciate your words very much. Okay, so as he shared his beautiful story and his journey, he mentioned allies. He mentioned times that were difficult, but times when he felt included. And so in the Dignity Model, it talks about inclusion. And inclusion, no one likes to feel left out, that they don't belong when we are included, just as the quote he mentioned, Joel, it doesn't make us feel good when we're not included, right? When we're excluded, we think, what about me? That I'm not included, you have self-doubt. It's an affront to our dignity at all levels of human interaction, from the political, from when minority groups feel left out, to the majority, interpersonal. Inclusion is so important to feel a part. And some of you may know, before I had the opportunity to live and to work in Japan. And so this is my inclusion story. And so as you go into the next slide, you'll see what was beautiful. This is me and my students. I taught middle school, and they're wearing my mother's dress. We had a fashion show, and obviously, Joel, you took my words, because I always say you could find me in this crowd as well, right? And what was beautiful was I lost my mother when I was 16 years old, and the students said, we want to honor your mother. Can we model the clothes for you? And so here we are all wearing my mother's clothing. And then also in the next slide, that is our traditional wear. So I'm Nigerian, so we wear, those are the traditional wear that my mother would wear and I would wear, which was very similar to the kimono. And so the same girls modeled my African clothing as well, because they were so interested in learning about who I am. And so when we think about that in the next picture, it completely guided me. And this is my favorite picture, because if you see next to me, they said, oh, sensei, this was after 2 years I was leaving. And the young man, Kengo Takayama, next to me, approached me one day and he said, oh, sensei, I looked up the word black in the dictionary and it says dark, gloomy, and evil, but that's not you. You're a ray of sunshine. He was 12 years old. So here I am in rural Japan, the first Black teacher in this room, in the school, first Black person to live in that town, and I felt included. I felt valued. I felt appreciated. And he didn't see the skin that I was in. He saw the beauty of what I was. And I could not help to hold back tears. And him and I, 12-year-old Kengo Takayama, he wrote an excellent essay where he said his interaction with me made him want to see the world. But he doesn't understand that his interaction that I had with him changed my life forever. And I use this story every time I talk about diversity, equity, inclusion. And so when you think about that in the next, it's important. I have an inclusive of friends. She's Japanese. She's Indian. She's Brazilian. I'm Nigerian. She's white American, but we're friends. We call ourselves the Mom Squad International. This was the beauty. Why? Why is this so important? Because of the future. If you look at the next slide, this is our future. These are the children of the Mom Squad International. This is what we should aspire to be, where our behaviors guide who we are, what we are. This is the children, just as Joel talked about his children, this is the future. And look at that, this day, they all came actually to celebrate the day of my daughters because we were moving here. And this was the last day that we got together as the Mom Squad International in my coming here. So I implore you, take the time to get to know someone. Take the time to get to learn more about the Asian American Pacific Islander community. There's so much richness and beauty, and it has added so much to my life. And I am so appreciative of the people that are in my life, my friends, my Mom Squad, and so many other connections. And I appreciate the love that they made me feel included. And so as we go in talking about inclusion, I want to talk about acknowledgement. Asian American Pacific Islanders on this call and beyond, we acknowledge you. You matter. It's as simple as smiling, recognizing them for something they have done or which they deserve. And it's also important to acknowledge the impact of your actions when we violate that person's dignity. And so here to talk about acknowledgement is Zionette Manalastas, who is the Administrative Clinical Supervisor, to talk about what acknowledgement means to her.
Hi, good afternoon, everyone. First, I'd like to thank Kara and Yemisi for putting this together. This means a lot to me. I'm really glad that Baystate is doing this to support and assure us that this group cares. I want to share a little bit about my background. I came to the United States from the Philippines on June of 1996 under working visa as an agency nurse, where I worked from different facilities and places. I would work from hospitals, nursing home, clinics, from Bronx, Brooklyn, Queens, Manhattan. Every day was different for me. I was young, so I took that challenge. But before coming here in the United States, I have a lot of anxiety. New environment, new culture, new weather, new food. But most of my anxiety are actually if I would be appreciated and accepted as a foreign nurse. While I was working as an agency nurse in New York City, I felt like everyone was busy and no time for acknowledgement and appreciation. I did not take that personally. I just thought probably that's how they work in America. Then I moved to Massachusetts. Started here at Baystate in August of 2000. As you can see, I've been here for so long. I started as a flex team RN. I'm one of the pioneer RN in the flex team. To be honest, I felt appreciated and valued. I had a good manager. Staff are so thankful that I'm here to help. It was a totally opposite experience from New York City. Being acknowledged and valued are some of the reasons why I stayed in Baystate Medical Center. So when I learned that Baystate will get international nurses, I was so excited because first, this will help with our challenging staffing. And second, I want to meet people from different places. So when Jody Peltier, my previous manager, told me that there will be some international coming in the ED, I connected with Gena Costello right away, the PD ED manager, and asked her for their names and telephone numbers. So when I was able to connect with one international nurse, it made a domino effect. I met many international nurses and learned that most of them don't have family here in the United States. So I invited them to my house, invited them to go out, show them around, as you can see in the picture. I welcomed them. I wanted them to feel that they are welcome here and we appreciate them, because I know how hard it is to be away from your family, and I know how it feels of being homesick. Reaching out to them is start a new friendship. Even with this COVID challenging time, this did not stop us from supporting and helping each other. Example of this, two of our friends, husband and wife, who got hit by COVID-19. The husband ended up in the ICU, and the wife was left at home battling COVID with two kids and two elderlies. Our group of friends with the international nurses came up with a plan to help them by bringing breakfast, lunch, and dinner for their family. We even made a Google rotation list schedule, what to bring and whose turn to bring it. So I'm so thankful actually they both recovered. This is one of the example of simple acknowledgement led to strong support system and good friendship. And to battle COVID-19 cabin fever, we always connect with each other and think of some interesting things to do that is safe for everyone. As you can see in our photo, we still have a good time and appreciate one another. As an administrative clinical supervisor, when I do my rounds in the hospital, I try to talk to many staff as I can. I try to find out what their concern and struggles at work and offer help. I do my best to explain the situation my situation for them to have a better understanding of what is going on and appreciate what they do, because I know how it feels to be in their shoes. I know sometimes even a simple smile, reassurance that your concerns are being heard, make you feel that you matter. If I have the opportunity to brighten up someone's day, I would make them feel acknowledged and valued. I choose to be the person who initiates conversation and give a smile. For me, if you value and acknowledge people, they will also value and acknowledge you. So I guess that's all for me. Thank you, everyone.
Thank you so much, Dee. Thank you for sharing your story with us. And thank you for your support with the International Nurse Integration Program. That was one of my favorite projects that Kara and I worked on, and we got to really connect with so many of you. And so as she talked about safety, talked about acknowledgement, just the simple smile, just the gestures of understanding. We also have to think about safety, right? And part of dignity, we talk about physical safety. We understand that. That is very clear. That's very acknowledgeable. But psychological safety, you know, we don't have, like Dr. Donna Hicks says, there's no ER for dignity wounds. There's none, you know, for the emotional wounds that we attend, words, epithets, things that are said against us, you know, it erodes at our spirit. And so it's important in order to honor people, particularly to give them dignity, is that we don't shame, that we don't humiliate, that we don't diminish, that we don't hurtfully criticize, okay? Our Asian American Pacific Islander colleagues and all of our colleagues at Baystate. And so I'm happy to share and introduce to you Regina Cuizon, who will talk about, and we also have Gena who will talk afterwards, that she is one of our international nurses from the Pediatric Emergency Department, who's going to share a story about safety.
Good afternoon, everyone. I hope everyone is well and healthy. My name is Regina Cuizon, and I work as a registered nurse in Baystate Medical Center, Pediatric CD. As an international traveler under OGP nursing agency, I started my journey in the US way back in 2011 with them. I was inspired by my family members who have lived in the US since in 1970s, and I opted to burn my midnight candle and eventually pass the NCLEX in order to achieve the American dream. Interestingly, at some point, my paradigm shifted and I made a decision to immigrate from the Philippines to Perth, Australia, the land down under, home of the Sheilas, blokes, venomous snakes, of which 21 of the most venomous in the world are lurking. But of course, that's another story. I studied, worked, and lived there for many years. But, while everything in life was going amazingly in there, I felt that, it was time for me to shaking things up and leave my comfort zone and explore the world again. I've been blessed with a profession that gives me the opportunity to travel and see the other side of the fence. And so I decided to get a job in the US in connection with my agency, and fortunately landed here in Baystate, Springfield, Massachusetts in 2019 with 2 big luggages with me and a dream. It was a tedious process, but I was determined. As well as a great mentor of mine once said, Regina, dream big and let those dreams come true. So moving to an area where, you don't know anyone is rated as one of life's most stressful situations. Personally, I have been very grateful that I was able to make friends inside and outside work. It helps make the adjustment much easier. Having a great support group has given me a sense of belongingness and helped me cope with life's challenges and living abroad. But developing and maintaining solid friendships takes effort and often is more difficult as we grow older. Still, it's wise to have a diverse network of friends, and it's also important to have a few truly close and dependable people who you can count on and who can count on you. So having said that, I made sure, being one of the international nurses here, made sure that whenever I learn from my managers that there are new international nurses coming, I am thrilled, and I tried to take time to welcome them, accommodate them in case, they needed a familiar face who can help them with their needs, like, as to make their transition here in the US easier. It's as simple as helping them find the best butcher shops, driving schools, furnitures, any points of interest around New England to bring their family for a road trip, or to what to wear on winter, which I myself was one of my struggles when I first came here in Massachusetts, because coming from a tropical country and all that, it was like I cannot anticipate what are the things I need to do. Recently there has been like a disturbing surge in racism attacks here in like Asians like me, and it has sparked by misplaced anger over after the pandemic. I reckon perhaps Asian American stories are often not told or heard in the mainstream. I have read like analysis released by the Center for the Study of Hate and Extremism at California State University in San Bernardino. This month examined hate crimes in 16 of America's largest cities. It has revealed that while such crimes in 2020 decreased overall by 7%, those targeting Asian people rose by nearly 150%, which is a huge difference. So when news of these attacks became public, my family and friends warned me to be alert and careful when I was anywhere outside my home. At the beginning of the pandemic, mask wearing was not required, but to protect people and myself against the spread of the coronavirus, it was something I wanted to do in our community, but I was hesitant and scared because I was told that, there are people who might avoid or harass me. Whenever my throat gets dry and I feel like I wanted to cough, I had to run and hide somewhere else away from others because I'm worried that someone might, assault me because I'm Asian, brown skinned, and I'm being judged that I brought coronavirus in this country. My parents cautioned me not to stay out late and to avoid sparsely populated areas as they are worried about, people might hurt me because I'm Asian. On the other hand, among the slights and stereotypes faced by expats like me is a pervasive theme. Go back to where you came from. Many have been told at some point in their lives, Asians like me, and I'm sometimes asked, do you speak English? Or should I talk about the times when, cold strangers would teasingly get in my face and pull at the corners of their eyes lifting ching chong chants. For the record, I'm not even Chinese, and it doesn't even matter what race I am. I don't even know how to use a chopstick, and I'm a Filipino Aussie. But what I remember the most were the stares. Some stares were curious, like a child who may have never seen a brown-skinned, chinky-eyed woman in their lives. Others were like, skeptical, cold. Like I remember a waiter wondering if I could afford to eat at the restaurant. At some point, some of them were like I said, were cold. Their opinion of my skin transcended any language barriers. They were all different types of stares, but the eyes all imply the same thing. You don't belong here. Despite that ever-present awareness of my otherness, my loved ones never stopped persisting in their mission to support me. They taught me to ignore the stares and pushed me to take up my space. It's one of the most important lessons I learned. While I seldom encounter implicit bias at work, they do happen from time to time. My response is always to educate ignorance and bad manners. There is a movement within the professional world that seeks to diversify its workforce. Enhancing cultural awareness and diversification additionally promotes understanding, communication, and positive outcomes, as research evidence suggests. So finally, to end up my talk, in addition to washing our hands properly and practicing physical distancing, we can use this time to understand the reason why racism is also a virus and why we all have a stake in stopping that racism that leads to xenophobia and hate crimes. To spread that messages and be kind to others. Thank you, everybody, and thank you for this opportunity to be heard.
Thank you so much, Regina, for your words. Thank you you are absolutely right. We need to fight the virus, and that virus is racism. You are absolutely right. And I thank you for sharing your stories with us. And as we have Gena Costello, please hold on. We still have, I know it's supposed to end at 1, but if you could stay on much longer, we have another wonderful story and want to create time and space for all of us to talk. So Gena Costello, the nurse manager of Pediatric Emergency Department, if you could please share your stories and words.
Sorry, trying to unmute myself there. Regina, you did such a great job. All the speakers have done such a beautiful job. This has been awesome. I have enjoyed every minute of it. I'm really honored. Thank you all for asking me to speak. I'm frankly honored to be in the company and that has shared such amazing stories. And we started the hour by just talking informally amongst ourselves. And I will say, I'm in the final stages of my career, and I am thanking my lucky stars that I ended up here at Baystate. In all honesty, I am proud that they address issues head on and they don't shy away from things, and they really have taken such a powerful stand in so many ways. So just a little bit about me, and I'm laughing. Do you guys see the very bottom is my mother ruining my life? So that was the slide my youngest daughter did when she heard that we were moving to the Middle East. Surprise! So for those of you who don't know me, I myself was an international nurse. I left the United States a few years ago to go to the Middle East and help open a women's and children's hospital in a little country on the edge of Saudi Arabia named Qatar. Being an international nurse myself was transforming. I had the opportunity to work with nurses from over 40 different countries and was humbled by the breadth of their knowledge and their caring. Thus, I was very intrigued and excited. I'm sure I was like jumping up and down when I heard that Baystate was hiring its own international nurses. I was lucky and jumped into it and said, let me. And so I got to be the first, and Regina was the first. Woo, Regina. to hire 5 nurses that came from a variety of areas: India, Ireland, Australia, the Philippines, and the Middle East. Fast forward, though, to the information session about our new hires, and staff surveys went out. They were done asking for thoughts, opinions, and concerns, and I see Yemisi nodding her head. And I was actually taken aback when I heard that people were worried about the skill set of our newcomers. I saw it just so differently. 60% of the PDED staff at that time had less than 3 years of experiences. The nurses that I hired, Regina included, had over 70 years of combined experience between them. They had all come from major pediatric referral centers. Frankly, seeing volumes of children we could only imagine. I needed their skill set. As the manager of my unit, I have made a conscious effort to learn and hear others, weeding out my own hidden biases daily. I work hard at being an ally, promoting discussions, having speakers come, speak about racial justice at our staff meetings, things like book club recommendations. And I saw this morning's speaker had recommended that book also. And more. We spend an awful lot of time at work, and it should be a place of safety, a place of opportunity, growth, place of self-actualization, and in the pediatric ED, a place of fun for sure. No one should live in fear. Having staff with diverse backgrounds makes us better. Our international nurses bring a wealth of knowledge, different and interesting perspectives, and so much more. We are better because of them. Thank you for letting me speak, and thank you for doing this.
Thank you, Gena, for constantly being an amazing ally. Thank you for being a leader. Thank you for being that leader to show we have these discussions. We talk about things that are yucky, but the point is about how are we going to get to the beauty? Part of it, sometimes we have to go through the yuckiness, the things that make us uncomfortable, so that we can get on the other side of greatness. Thank you for showing that in your words today. And so I know as we conclude, we usually have open discussion. I don't know if there's anybody that wants to share a story before we show our concluding video. But if anyone wants to come off mute, I see a lot of comments in the chat box. But before we show our concluding videos, any words that anyone wants to say?
Yemisi, this is Kara. I had an email sent to me for someone who wasn't able to be here today that wanted some words shared that I'd like to read. It's from a resident of ours, Dr. Joy Zhu, and she wanted to just read a short statement that she wrote that I wanted to share. She says, anti-Asian is not a recent thing. About 3 years ago, when I was just standing at a bus station waiting for buses in Miami, a woman sitting in the passenger seat in the passenger car rolled down the window and started to curse at me for no reason and passed by. Since March last year, there were times when I got home after work and met people on the street. I've always said hi. However, deep in my heart, I was scared that people might be mad at me just because I'm Asian. And now I've got into the habit of to keep my badge with me all the time, hoping that it could save my life in some extreme situations. I'm not the only person with these fears and concerns. My friend Emma, who also is Asian, and I had to cancel our trip in Tennessee due to safety concerns after knowing the shooting event happened, even though we had been making plans for the whole month with everything prepared. Why couldn't people just be treated equally? I keep asking myself. It sounds so basic, however, it's not easy to achieve. My simplest answer is the difference and the unfamiliarity from it. The international situation might have made it more difficult in this extremely challenging COVID era. However, my sincere hope is that every single individual owns the ability to live without fear from how they look and where they're from on this beautiful land. And that was from Joy.
That was beautiful, Kara. Thank you for sharing her words as we conclude. And just like she said, this beautiful land. She concluded with that beautiful land. Joel talked about America. We are better together. And so as we conclude in our song that we're going to play, we all bleed the same. I want you to listen.
We all bleed the same.
So to the words, as we conclude, we all bleed the same. If we're going to fight, let's fight for each other. If we're going to shout, let love be the cry. We all bleed the same. We're more beautiful when we come together. We're more beautiful when we come together. Because when we elevate the dignity of one, we elevate the dignity for all. Remember that. Let's lift each other up. We're more beautiful when we come together. Thank you so much for attending our third Elevating Dignity in solidarity with our Asian American and Pacific Islander community. We love you all, and it's been an honor and a privilege to be able to stand in front of you today, to share these series with you, to share the dignity model with you, as we all come together, elevating dignity, elevating, and fighting for each other with our love cry. Thank you so much for today, and it's been a pleasure and honor to serve you all. Thank you.